I'm here with Dr. Sarah Samreen, a family medicine. To begin, can you tell us about yourself and share what motivated you to purchase a career in medicine?
Yes, my name is Sarah Samreen. I'm one of the family physicians here in San Antonio, and I did my medicine from Pakistan, and then did my residency here in family medicine in San Antonio with UT Health Science System. Um, I mean, basically, my family, my sisters, they both are physicians too, and I'm the youngest of the three. And when I saw them pursuing the medical career and the way they were passionate about medicine, that made me more interested in looking into medicine itself. And even though my parents weren't in medicine, but I really wanted to see to choose a profession where I would, kind of be have the best of both worlds, you could say, like in a way that I'll be able to not just make my place in the society, a respectful place in a society, learn something worthwhile, as well as giving back to the society, and also able to help people. So it's there are many professions that you can actually do that in, and now more than ever. But back when I did my studies in 1990s, of course, we didn't have as many of opportunities, open opportunities, but it was still a good profession to choose. So that's why I chose medicine. Yeah.
What do you find most rewarding about helping people with both physical and mental health challenges?
Well, if you ask me, I feel like looking into a person as a whole is very important. Actually, medicine has come far in which they realize to see that the patients really need holistic care rather than just, hey, I mean, treating just one thing, like whether they have diabetes or high blood pressure or even cancer or some sort of disease. To take just the disease and move forward, I feel like it's a big accomplishment that we have come so far, that we realize that a person as a whole needs to be looked at, and they need to be not just involved in their care, but also we need to look at their mental health while we're treating their physical ailments and stuff, because a lot of things they do directly affect the way a disease process can happen. Not just the process of the disease itself can be affected by the mental health, but also the treatment and the recovery part of it is also affected immensely.
In your experience, how often do physical illness like heart disease, diabetes, blood pressure, and so on connect to mental health issues like depression or anxiety in patients?
Me being a family physician for almost 20 years, what I have noticed is in my patients too, and I think this is across the board, is when a person is any of these or any other diagnosis for that matter or illnesses, especially with the chronic diseases like you've mentioned, diabetes, hypertension, and heart disease or certain other, um, it's easy diagnosis. They need to realize, and they have to realize that as a patient, that their life is going to change because of this diagnosis. Um, a lot of things take place before the diagnosis happens. Of course, their lifestyle, how they are taking care of themselves, which, of course, anybody who is taking care of their own health or taking charge of their health has to be in a sound mental condition to be doing that. Like, people, those who we see that are exercising, they're taking care of their diet, even if they have family history of diabetes or high blood pressure or heart disease, they will actively, involve in and engage in taking care of their health, eating the right things at the right time, doing the physical activities that are required. Not to say that there are still people that would eventually have the disease, but they definitely push it farther out, and or it's not as bad, or as it doesn't come in with a shock like with the blood sugar of 400 and 500 when they're first diagnosed, rather than, hey, you're pre-diabetic, and then let's work on it. And that's how it progresses too. Even if it has to progress, or it has to, become a diabetes or a specific disease. So I feel like it starts from where a person's mental health is, how good it is that they actually can prevent certain diseases. Um, and once they are diagnosed, then how they take it. If they're in the right mental capacity and right mental health, if they are not already and dealing with anxiety, depression, or some other mental health or mental illness, then that kind of makes it very challenging for them to take on that diagnosis, which is going to change their life, the way they eat, the way they work, the way they diet. I mean, their physical activity and all those things, and taking their medication. So it affects all that also. And once they have actually actualized the fact that they have that diagnosis, then moving forward with that and trying to push away or keep the complications to the minimal. It takes a good, sound mind, healthy mind with good mental health to actually be, conscious of the fact that we want to avoid certain things or certain ways in this disease to avoid the complications and stuff. So I feel like there's a major interaction and connection between the mental health as well as any chronic disease.
What physical symptoms should doctors look for that could signal someone is struggling with their mental health, even if they haven't mentioned it directly?
So actually, that's pretty common, as you know, that in many cultures, it's kind of a taboo to even talk about or say, "Hey, I saw a doctor that is a mental health doctor," or "I have depression," or something of the sort. So it is very challenging. Very good question. So what happens is during the screening processes that we have in the clinics, our screeners, which are most of the times nurses or the medical assistants, they do ask a question while they're doing a vital signs of the patient, which are two question questionnaire that is added, and they kind of screens out somebody who's having issue with mental health or mental breakdown or depression. It's specifically mostly to treat to sorry, not to treat, to screen depression, but it can give us a little insight on something's going on. And that gives the doctor an indication, hey, the patient that's walking into the room, or the the room that you're going to enter with the patient in it, you want to ask certain questions to maybe get some details. So that's the first step. The second step is, of course, when we approach the patient, or when we greet them and we talk to them, their demeanor is a big thing. A doctor's It is a doctor's duty to actually be focused on the patient, not on their computer or on their machine. um, as the patient is walking in, or as we are walking into the patient room, and we're looking at them, greeting them, to see them how they are responding to your greet. If they are smiling, or if they're in pain, or if they're sad, or whether they're making that eye contact. All those little cues, they are very important. Um, the other few things that will come as we go into the interview further with the patient, besides asking them the questions directly of whether you're depressed or are you having any sleep troubles. So patients with sleep problems, or they may not say they're depressed, but they may say, hey, I'm not having enough sleep, or I can't sleep. Then exploring that can actually you can get to the bottom of what's going on, whether their sleep is actually a sleep problem, or they're actually going through some mental stress that is not letting them get a good night's sleep. Um, the other thing would be, again, like I mentioned, eye contact. Um, if they are not showing much interest in the activities, like certain times there are patients with chronic pains. Um, I mean, like chronic back pain or knee pains and stuff like that, and they are not able to do their activities that like they're able to do or they were able to do previously. And they used to enjoy the things like gardening or walking or going out to the park or maybe mall and stuff like that. But if they're saying that, hey, I'm not able to do that anymore, and I'm feeling, or I feel like I can't get out of my bed without pain, or I'm in pain all the time, all those cues can actually should ring a bell in a physician's mind that, hey, this could be something leading towards, or the person can be a little depressed or can be depressed, or if not depressed at the moment, can actually become depressed. So it also brings in a preventive context into this too. So yeah, that's basically our few things that we look at.
How can doctors and the community become more comfortable talking about mental health with their patients, especially since culture beliefs may play a role in avoiding these conversations?
As you mentioned, and yes, there are many, many cultures, including here, like we see in US, the Hispanic culture, some other cultures, Arab culture, India, Pakistani culture. They are very shy of. Uh, Things have gotten better, I think, because of the internet and because of the too many people talking about it, like on the media and social media. I mean, and it's becoming a little more norm that people are talking about. Hey, I have anxiety or I have depression or something or mental breakdown because of something. But it's still for our older population or senior citizens and some other that may still feel like that are more culturally oriented, that may feel like that this is not something that is more personal and they shouldn't talk about it even to their physicians. So that can be a little challenging. But I feel like here again, the providers or the physicians' responsibility comes in, where they actually need to open up um, to the patient about this, be more active listener into picking up these cues and then reflecting them back to the patient by saying, hey, I feel like you're, for example, if somebody's in pain, then you would say, hey, I mean, this is going on and you are not able to do these activities that you were able to do before. So how is it affecting you? Is it affecting your livelihood? Is it affecting your mental health in any way? Do you feel still happy? Are you still satisfied with your life? What's going on? So asking those kind of questions, open-ended or certain close-ended questions too, would maybe actually invite a patient to tell you a bit more about it. Number two, telling them how this affects their other diseases, like what we mentioned earlier, that how having a sound mental health or a better mental health would help them take care of their chronic diseases and would also keep them from affecting those chronic diseases and their treatment and their complications. Because once we, you know, teach a patient in a way, like it's our duty to teach them, just like we teach them about the medications or the disease or the diagnosis. This is our duty to teach them the effect of mental health on their health, so on their physical health as well as their diseases and stuff, so that they realize that fact and then be a little bit open about it and get help. Because many times we can see that certain things can go on without being treated, like for example anxiety not being treated initially and going on as a vicious cycle and becoming something that the patient is not a positive as well as a productive member of the society, and or depression for that matter, that it becomes so bad that they are not able to deal with it themselves, the patients or the families are don't know how to deal with it, and the patient becomes passive, very passive, and is not a productive member of the society or their family. So that can be really hard and challenging at the time. So initially, I feel like it is the responsibility of the physician, if their family member is next to them, to teach their family member also how to recognize and how to deal with initially, and also to how to tell the doctor also that this is what's going on in the patient's life, just so that we can help them together. So I feel like it's very important. teaching tool or educational thing from a physician's point of view for the patient to teach them so that they realize that it is an important aspect so they can come forth.
Stress can cause so many problems in the body. Can you describe an example where you've seen stress led to physical illness and how mental health treatments help improve the overall health of a patient?
So many times, of course, and I'm pretty sure any doctor will be able to answer this question. It's not a far-fetched thing. Um, we see that all the time. Like talk about simple thing as diabetes. We already know diabetes itself can affect from head to toe a patient, and with the way the diabetes occurs and the way the diabetes presents is the high sugars in the blood. And there are many processes in our body that takes place, the hormones that are released or the steroids that are released in response to the stress that can actually bring about more changes towards worsening of the diabetes, like higher sugar levels at certain times. So same thing with the blood pressure, like a person who's under stress or hasn't slept because of the stress or things like that can actually increase their blood pressure. And I mean, all those things. So we do see that very commonly. I mean, this is not something that is uncommon.
What would you say to families who are unsure about seeking mental health treatments, and how can they understand that mental health is just as important as physical health for overall well-being?
Basically, again, I would it would come down to educational programs. This is very important that we provide that education to the communities around us. A doctor can simply talk to their patients and their families while they're talking to them in their clinic, but I think we should not wait for a patient to walk into the clinic to be hearing this. People, general population, because everybody is going to get disease at one point in time in their life. So we should preventatively do this, do some workshops, do some programs for the communities around your city, around your county, to actually provide some education to the patients as well as, I won't call them patients, like to general public basically, and just so that they are aware, that there's a big this connection between the mental health as well as how it affects your chronic diseases, and how we can actually take care of both of them or both of them together to take care of their chronic diseases as well as mental health, to make sure that the outcome of everything is good rather than worsening. And for them to tell them the importance of mental health and how there are treatments out there, not just medical treatments, like not just medicines, but also counseling and certain other behavioral therapies and certain other things that are easily aware, or what resources they have. I won't say easily because there are many things that are not easily available, especially when it comes to mental health, or they may not be readily available, and the appointment times may be farther out. So basically giving them the resources list, and telling the community that these are the programs that are available out there. What are the free programs? What are the charges, or the ones that charge, or the private programs that charge a fee, sometimes a hefty fee, or are aware of these resources. Many a times, it's a matter of not knowing what resources are available, which is kind of the hindrance for a person to be finding help. That's why I feel like this is very important that we provide that education to the community. Yes.
Thank you, Dr. Samreen, for taking the time to speak with us today. Before we end, is there any final message or advice you'd like to share?
No, thank you for having me here. Sorry, I will say one thing as a physician, of course, this would be a message to my fellow physicians. I have worked with a lot of patients that have actually have mental issues along with their health issues because I've taken care of homeless veterans for many years, and that kind of gave me a broader idea about how all of this can affect the health, how it affects the mental health. So it's not just a one-way street; it's a two-way, and these both needs to be tackled together. So please do not shy away from asking question, or if you feel like the patient is implying something like their sleep issues, sleep patterns, disturbances, or their physical activity issues and stuff, to explore a little bit more, go a bit further in, and spend a few more extra minutes in exploring this. That will save that patient and you a lot of pain in the future. Yeah, I want to say that. Thank you.